Again, good afternoon, everybody. We're going to go ahead and get started. As I said, my name is Leanne Foster, and I am a Medicare Provider Outreach and Education Specialist here at WPS Health Solutions. And again, I'd like to thank you for your time today and welcome you to our webinar for Medicare Diabetes Prevention Programs, or MDP, Business Structures and Enrollment. I will start with a disclaimer. So the material that you are viewing today, the material that's being presented today, was created based on the most current CMS rules and regulations. I'll also be answering any questions today based on the most current CMS rules and regulations. If you've been involved with Medicare for any period of time, you're certainly aware of the fact that Medicare does change often. So I am going to continue to encourage you to review official CMS communications, which will include not only the CMS website, but also the WPS-GHA website for the most up-to-date rules, regulations, and communications from CMS. Now, I did mention questions. Questions are going to be handled through the chat today, and Ellen is monitoring those questions so that we don't miss any. Sometimes I can't see questions, so we just have an extra set of eyes on those chats so that we get all of your questions. If for some reason we do not have time to answer all questions asked today, I will be creating a follow-up document that will include all questions and answers that we did not get to today and send that out to all attendees. We are recording this session, so as part of that, CMS does prohibit the recording, screenshotting of this education for profit-making purposes. Now, because I am recording it, you are going to have this available to you after, so there's simply no need. So it's going to be available to you on our YouTube channel as soon as possible after this event, barring any technical issues with the recording, which we do not anticipate. That's going to be available in two places. It's going to be available on our YouTube channel, and it will remain on our YouTube channel as long as it is current and relevant. However, we do also recognize that in today's security climate, we're all being careful. Not everybody can access YouTube from their work computers or their workstations. So what we've also done is we have embedded a player on our WPS-GHA website, and it will be made available there without the need to access YouTube to play the video for 90 days. So you'll have that available to you as well. And you'll receive notification in our e-news when that's available. That brings me to our agenda for today. As I said, today we are covering MDPP business structures and enrollment. So we're going to be talking about what the business structures look like that we typically see when enrolling and how those business structures are going to impact the enrollment process for the MDPP supplier. We're also going to walk through not only the enrollment requirements and process for MDPPs, but we're actually going to walk through the enrollment application, which is the CMS 20134 application for MDPP suppliers. That is going to include both the paper and the electronic version of that form. I will be using several acronyms today, so I have also included a list for you of the acronyms that I'll be using throughout the presentation. That's available in the training material that you can access by going to our live events page and simply search for today's session, and you'll have a download link for that training material. And the training material available today is the PowerPoint presentation. It'll also be available for the recording. So Medicare will cover services provided by Medicare Diabetes Prevention Program Suppliers, or MDPPs, with the goal of preventing the onset of diabetes in individuals that are pre-diabetic. The requirements for the MDPP supplier is laid out in the Code of Federal Regulations, section 424.205C1, and that includes the services and the enrollment requirements. I have included a link for you if you'd like to take a look at that after this presentation so that you have that information. But as I said, the ultimate goal is that They are intervening, trying to prevent the onset of diabetes in patients that are pre-diabetic. So the things that that program is going to look at, it's an intervention program, and it is looking at targeting things such as dietary changes. Those changes are going to be made through education and coaching to that beneficiary, to that patient. We're also going to look at physical activity strategies that the beneficiary may implement to increase their activity level. And then we'll also look at any behavioral changes that can be made, again, with the goal of preventing the onset of full-blown diabetes. When enrolling an MDPP, and determining the business structure, there's something really critical to look at, and we really need to understand the type of locations that will be reported on the enrollment record. So for MDPP suppliers, there are two types of locations: administrative locations and community setting locations. And they are different. So I'll start with administrative locations. So an administrative location is going to be a physical location that is associated with the MDPP operations. So this is going to be a location where the MDPP is the primary operator of the space. Maybe they lease it, maybe they own it, but it's not a shared public use space. It is their essentially physical location. The provider may have multiple administrative locations. That is perfectly acceptable, but they will need to list all of them in the event that they have multiple. Our claims adjudication will look for these locations, and so it's really critical that they are listed on that enrollment record when that is created for them. Also think about this as where the coaches are dispatched and based, but keep in mind the MDPP services may or may not be furnished here. They can be furnished at an administrative location, but if they have community setting locations, which we're about to talk about, it may simply be where the coaches are dispatched. But there has to be at least one location that MDPP operates out of that is in their primary control. For a community setting location, these are obviously, as I said, going to be outside of the administrative location. Examples, and I've listed some here, it could be church basements, it could be multi-purpose rooms, it could be recreation centers, community centers, public spaces, again, that are not primarily controlled by the MDPP supplier. These are going to be settings, though, where the services are furnished. Again, the administrative location can potentially be simply for dispatch, but a community setting, the services do need to be performed there. And as I said, they can have multiple. There's no limit on the number of locations that they can have. So now that we've talked about those two types, we're going to walk through a couple of examples and talk about how these business structures are going to impact the enrollment process. So the first example that I'm going to show you is pretty basic, and it is the business structure that we see most often in the provider enrollment chain and ownership system, which is PACOS, also known as PACOS. It is the national enrollment system that houses all enrollment data for CMS and the Medicare program. So this is an example of an MDPP enrollment with a single location. So here you're looking at, they have one location. If you have one location, it's going to need to be that administrative location. You wouldn't be able to have a structure that is one location and it's only a community setting. Again, this is that administrative location. In this example, it is in one state, so it's also going to be one MAC jurisdiction. Services are going to be delivered there. If they're reporting just that administrative location and that we're not getting any community locations, we are expecting that services are going to be delivered there because we need to know our services are rendered. So when this business structure were to enroll in Medicare, it will require one enrollment application, and they will have one enrollment record built with one provider transaction access number, or one PTAN. So again, this is the most common, this is the most basic, this is the starting point. So moving on to an example where an MDPP enrollment has multiple locations. In this example, we're showing that on the left, you'll see a provider with multiple administrative locations and no community locations. So they are the primary user of both of those administrative locations. They're not public. This is okay. You can, as I said, have multiple administrative locations. On the right, what you're looking at is an MDPP with one administrative location and two community setting locations. The difference here is that the MDPP is not the primary operator of the two community setting locations, as we mentioned before. They're open to the public, but they are providing services there. In the example that you're seeing on the right of this image, that administrative location, they might be providing services there. They might not be providing services there. It could be that they're simply dispatching the coaches from that location, but both are fine. So that's really that key question that you need to ask yourself when deciding if a location is an administrative location or community setting. Who is the primary operator? Now, in this example, both of these scenarios are located in the same jurisdictional state. So for enrollment purposes, both of these business structures enroll the same way. It's all happening in Iowa. It's all happening in one MAC jurisdiction. It's all happening inside a WPS jurisdiction in this example. And so regardless of which business structure they're submitting, it would be one application. They would receive one enrollment, and we would issue one PTAN. So it's not really that dissimilar from the basic structure that we just talked about. It just has multiple locations, but it's still pretty simple, pretty streamlined. We will list all of the locations on file so that we have that for claims adjudication. This is another example of an MDPP that has multiple locations. However, I've changed it up a little bit. What you'll notice is that the example on the right is in the state of Iowa, and the example on the left, on the left is in Iowa. I apologize, and the example on the right is in Kansas. And you'll notice that both of them have multiple locations. So what's a little bit different here is you'll notice that in Iowa they have two administrative locations, and in Kansas they do not have any administrative locations. And we're not going to enroll an MDPP supplier without an administrative location. That has to be there. We can't enroll them with just community setting locations. However, in this case, because Iowa and Kansas are both in the same MAC jurisdiction, we can enroll both the Iowa locations and the Kansas locations on one enrollment. What will happen here is that the provider will submit an application to the MAC, which in this case is WPS, and they will report both the Iowa and the Kansas locations on that one application. So with community settings, because they're not in primary control of the MDPP, they can cross state lines. When that happens, and you have community settings in multiple states, as you do here, the enrollment is based off of where the administrative location is. So in this case, they have multiple administrative locations in Iowa. We're going to enroll them in Iowa with two administrative locations, and they are going to also have 4 community locations or community settings, 2 in Iowa and 2 in Kansas. But you will have addresses for multiple states on one enrollment. And for MDPPs, that is okay. This example, we've changed things up just a little bit. So here we have an MDPP that is practicing in 3 states. So they have a location in Iowa, they have a location in Kansas, and they have another in Illinois. Because they have multiple administrative locations in multiple states, so they have 2 in Iowa and 1 in Illinois, we have to start looking at what MAC jurisdictions those states are in. Iowa and Kansas are both WPS jurisdictions. So that's going to be very similar to what we just discussed. We can enroll that provider with an application in Iowa, and we will list the Iowa community setting locations and the Kansas community setting locations in Iowa, because those are all in WPS jurisdiction. The Illinois administrative locations, a little different. It's in another MAC contract. So that is going to require a second application. And in this case, the MDPP supplier will receive multiple enrollments and multiple PTANs, and it will involve multiple MACs. So the two are not crossing. And that's really the thing to look at. Community setting locations can cross state lines. Administrative locations cannot. One thing I do want to add to this as well, and this can happen as well, you may run into a situation where you have a provider, say this provider was already enrolled in Iowa with the 4 community settings. The other thing that can happen here is a change application, or the provider will think they're going to add a location and that is a change application. If it is the community setting, it can cross state lines. In this case, it would require an initial enrollment that would go into Illinois for that other MAC. And right now, there is a flexibility that will be in place till December 31st of 2027 that eliminates any type of an enrollment fee, or it suspends any type of enrollment fee at this time. Once those flexibilities are allowed to expire, again, December 31st, 2027, in this scenario, it would result in a second fee because it's going into another MAC jurisdiction for that Illinois administrative location. So just something to keep in mind. The last type of business structure that I'm going to talk about is going to be an MDPP CDC umbrella. So this is a CDC umbrella enrollment, and this is where an organization is going to serve as, they're going to oversee another organization. So it involves hubs and subsidiaries. So I want to talk about the difference between a hub and a subsidiary here quick before I go any further. So a hub is serving as the sponsoring organization for a group of subsidiary organizations. So they may be different organizations. Any CDC recognized organization, so if they've received their full recognition from the CDC as an MDPP, can apply to serve as a hub or an umbrella. And it is something that the providers do need to apply to the CDC for. This is outside of the MAC. This is outside of provider enrollment. There's actually, I'm going to go to that website and I'm going to provide that for you. There is a resource, and this is not in your presentation, so I'm going to add this here, but there is a page for the affiliated with the CDC that talks about how to apply for an umbrella hub, what that arrangement looks like in more detail, if you'd like to take a look at that after the session. So again, they have to apply for it and be recognized, and they're going to get a code that recognizes them as that hub. Now that hub organization has to be fully recognized by the CDC as an MDPP, and they have to be in good standing with the CDC. And they also have to be offering ongoing classes. So they have to be fully functioning. They also have to agree, if they want to be set up as this umbrella arrangement and bring other subsidiary organizations in, they have to agree to the arrangement for 2 years. And that is all under the requirements and responsibilities of the hub. That's the primary organization. Now the subsidiaries, almost like a parent-child relationship. The hub is a parent, the subsidiary is a child. So those subsidiaries are going to have oversight. That hub is going to be responsible for oversight specifically for that subsidiary's eligibility and participation criteria. Initially, a hub is going to be allowed to invite up to 5 CDC recognized organizations, regardless of whether or not they have pending, preliminary, or full recognition to join. And that recognition is coming from the CDC. Now that 5 is an initial limitation just to allow that hub some time to get experience with this type of relationship and managing that. They don't want them to expand too quickly. But once that arrangement is working successfully, the hub can be asked to invite additional organizations. And again, there's more information about setting up that hub and adding those subsidiaries on the CDC website. The subsidiaries, though, also need to be in good standing with the CDC, so they can't be under any type of CDC corrective action or in any type of CDC-initiated quality review. That's what good standing means. And so what you're looking here is an example of a CDC hub that is currently enrolled as an MDPP administrative location based in Iowa. That's what you're seeing on the left. They're the hub. It involves 2 MDPP supplier enrollment applications, and it involves 2 because the enrollment is still very much the same, where we have Iowa with their administrative locations, and that's the hub. They have 2 community settings in Iowa, 2 community settings in Kansas. It's all the same jurisdictional MAC. All of those locations can enroll with 1 application and 1 MAC. However, again, we have a subsidiary that is located in Illinois with an administrative location versus a community setting location. So that Illinois location, because it's an administrative and is for a different MAC, does need to be enrolled under a separate application, 2 enrollments, 2 PTAN. So it's really coming back to community settings can cross state lines, the administrative locations cannot. Now, one advantage here, though, is that the subsidiaries can use the same organizational code from the CDC, and they can use the same NPI as the hub. So with that, I'm going to take a little bit of a pause. That's a lot of information, and I'm just going to check in with Ellen to see if we have any questions in the chat.
Leanne, we don't have any questions at this time.
All right, thank you, Ellen. Then we will continue on. And we're now going to talk about the enrollment process itself and how the MDPPs are going to enroll in the Medicare program. There are 2 options for enrolling. There is an electronic option through PACOS, and there is a paper application option. One thing I do need to point out, and I mentioned it earlier, is that MDPPs are not going to use the typical CMS 855 enrollment applications that all other Medicare providers will use. CMS has created a separate application specific for MDPPs that tailors to the need for those community locations, administrative locations, that CDC recognition, and the coaching. There are enough differences that CMS deemed it necessary to create the CMS 2134. And this is just a screenshot of what that cover page looks like. That is available on the CMS website. I've included links in your resource section of the training materials today to that paper application form. The paper application form, it is a PDF template. It can be completed, but then it does on the website, but then it does need to be downloaded, printed, signed, and mailed in. It cannot be faxed in. It cannot be emailed in. There is not an electronic method to submit a paper application. The electronic method is through PACOS, and it is the most efficient way to submit an application. You can fill everything out online, which also eliminates the need for some of the data entry. When you can sign it electronically, and when it's submitted into the MAC, we can see it the next day after it's submitted, and then it gets ingested into our workflow system and processed in priority order. But because you're eliminating the need to download, the need to mail it, the need to scan it and ingest it into our system, we do have significantly shorter processing times on those. In fact, an electronic application that requires no development typically processes within 15 calendar days, and a paper application is typically processed within 30. So it's significantly different. Again, data entry is automated. There are some verifications that are automated. So I highly encourage that. The other reason I encourage PAYCOs is that you will have access to see all of the information that we currently have on file. So you'll be able to see the locations, how they're designated in the system, in anything in real time with any application that's been finalized. It's also particularly handy at the point of revalidation, which is a process of recertifying all of your information every 5 years. If you're in PAYCOS, you go in, you view the information. If there are no changes, sign it and submit it. Significantly easier. Before I do look at specific application sections with you, I do need to take a moment to point out, though, that PAYCOS submissions, if you have submitted CMS 855s through PAYCOS before, MDPP applications are going to look different than a CMS 855 in PAYCOS. And this is because the CMS 2134 application is significantly different from the other CMS 855 application electronic versions. And so that to eliminate confusion and make it simpler for the provider and the MACs, they created an abbreviated enrollment process basically in PAYCOS, and that application is initiated during the questionnaire process in PAYCOS. So if you're not familiar, PAYCOS works a lot like a do-it-yourself tax program in that it asks you a bunch of questions about what you're trying to do. Are you a new enrollment? What state are you in? What specialty or supplier type are you? And when you select MDPP in PAYCOS, it's going to give you an alert telling you that you are leaving the standard PAYCOS and you are accessing PAYCOS for an MDPP. You will answer yes to that. You do want to do that because you will not be able to enroll that MDPP through, say, a CMS 855B submission in the PAYCOS system. And then that MDPP application will walk you through the sections that are necessary to enroll. So once you're in the application, you'll start with section 1A, which is basic information. And as we go through this, what you're going to see on the left is going to be what the section will look like in PAYCOS. I do apologize, the images are just a little bit fuzzy when they're coming through WebEx, so I apologize for that. And then on the right, what you're going to see is that paper application. And in PAYCOS, they're going to be referred to as topics or sections, but they do line up with the CMS 2134, which will be a section of that application. So section 1A is the application reason. In PAYCOS, you've essentially already answered that question. You said you were an MDPP, and so it takes you into that process, but it's going to take you to a page where it's confirming you are enrolling as an MDPP. On a paper application, you're going to have to tell and select the appropriate box and tell the MAC what you're trying to do by checking the reason for application, which is the first column. And then if there's any billing number information required, say if you're doing a change or a termination, or you're reactivating something. And then in that third column on a paper application, it's going to tell you what sections of the application need to be completed. In PAYCOS, it's just going to present you based off of how you answer those questions. Next, you'll get into identifying information, and in both PAYCOS and the paper 2134, you are going to be asked questions about your business. So legal business name, tax ID, is there a doing business as name? Is the entity for-profit or nonprofit? And what's that corporate structure look like? PAYCOS is going to ask you for that same information. With the tax ID, that is something we'll talk about a little bit later, but you will need to provide documentation of that tax ID and the legal business name that coordinates with the enrolling provider. And that's true of the umbrella organizations as well. They may get to use that CDC org code, and they may be able to utilize the same MPI, but they are likely, typically, going to have their own tax ID and legal name. Not always, but typically. The next part of section 2, and it's the bottom part of that page that you just looked at for the paper application, but the next section is recognition status. So this is your CDC recognition status. You do need to have either MDPP preliminary or full recognition by the CDC before you can enroll in the Medicare program. So that CDC piece does happen first. If you don't have that, we'll be unable to process that application. I have included a link that goes through the requirements for that recognition, but for preliminary CDC requirements, it includes the use of a CDC approved curriculum, and you can use a curriculum that's developed by the CDC, or you can develop your own, or something from another organization, provided you have their permission. CDC will need approval of that. Okay, and there is a list of some of those curriculums. I'm actually that's going to be on that link that I've provided here. I did actually give that to you, sorry. You're also going to need to be offering the lifestyle program within 6 months of receiving approval from the CDC. So you've got to be geared up and ready to deploy your program. You're going to need to look at capacity and commitment to deliver the program for at least a year. And this would include 16 sessions during the first 6 months and at least 6 sessions during the last 6 months. And again, these are all outlined in that link that I'm giving you. You're going to need to maintain data on the participants' progress, and this will include things like weight, physical activity in minutes. Remember, we're talking about lifestyle changes to prevent the onset of diabetes in patients that are pre-diabetic. And you'll need to collect that each session every 6 months. Your program is going to have trained lifestyle coaches who can help build the participants' skills and confidence so that they can make those lifestyle changes and that they're lasting lifestyle changes. And then each program is going to need to have a designated individual who will serve as the MDPP program coordinator. So somebody that's overseeing that program, maintaining that curriculum, ensuring that the coaches are certified appropriately. That's the kind of information that you'll need to get that recognition that you're reporting here. Section 2A, simply a correspondence address where we can reach the MDPP supplier should we need to. This is a super important address when it comes time for revalidations. When it's time to revalidate, the revalidation notification letters are sent out by physical mail, and they are sent out to the correspondence address first. They may also be sent out to the physical location and special payments address, but it starts with a correspondence address. And so to avoid missing one of those, you want to make sure that you have the appropriate address here and that you maintain that. Failure to respond to a revalidation is something that can result in disruption of claims payment, and we want to avoid that at all cost. So this can be, it does need to be a street address. It can also include a PO box, but we do need to have that street address. And it cannot be the billing agency's address. So it has to be an address for the provider. Section 3 is adverse legal action on the entity itself. So this is looking for any of the convictions or exclusions or revocations or suspensions as defined in the enrollment application. We're not looking for anything that's been dismissed or action hasn't been taken on. Again, it is administrative or adverse legal actions that have been taken, and they don't necessarily preclude an MDPP from enrollment. If a supplier indicates that yes, they have some. They do need to provide information about who took the action, date of the action, if there was a resolution, what was it, when did it happen. And we're also going to look for court documentation that includes the action and the resolution. This is reviewed by MAC and sometimes in coordination with CMS to determine if this poses a risk to the program. So just because you have one, don't think that that would, if you were to have one, that does not preclude you necessarily from enrolling. It's just about knowing what has happened in the past and what it's a risk assessment. It's to help us ascertain the risk posed by the provider, if any. So section 4, we're getting to the MDPP location information. Again, you're looking at it from the PACOS and the paper enrollment application. You'll notice on a paper application it is multiple pages. One administrative address, as I've been saying, is always required, so we need to have one. You are going to also be asked for for your community setting locations, and you need to report all of the locations. Those are all going to be housed in the enrollment record, and as I've stated a couple of times, it does impact claims adjudication, so we need to make sure that that's there. In this section, you're also going to be asked for a special payments address for the MDPP. You can only have one. It can be one of the locations that's listed on the application as an administrative or community setting practice location, but it also does not have to be that. So, and that one can be a payment PO box as well. We pay all Medicare providers electronically, and we'll talk about that in a few minutes, but we do need to have that special payments address listed. In the event that there would be challenges with the electronic payment, and there are other pieces of correspondence from various areas within Medicare that may send out communication regarding claims to that location or that special payments address. Next, we're looking at record storage. This is exactly what it sounds like. So this is where medical records are going to be stored. We do need a physical street address, so a PO box isn't going to work here. We do need that address. It can be the same as one of the locations, but we do need that listed here. It also, in this day and age, is very common for providers to have electronic medical record storage, and that is perfectly fine. They do need to indicate that they are storing them electronically, and we are going to be asking for the name of the service or vendor. We do need to have that. We don't need a link to the program or to that vendor. We just need that, that name so that we know which service or vendor is being used for those. Section 5 and 6 are coming up here, and they're fairly similar. This is about ownership and managing control. Section 5 is about organizations that have ownership or managing control. And by managing control, they're overseeing day-to-day operations. They can make decisions about how the business operates. They may have access to the funds or make business decisions about those funds. And this varies depending upon how your supplier is set up. So it's going to be unique to the various MDPPs that we enroll. But we're looking for anybody who is a direct owner, meaning they own directly the enrolling provider. You do not list the enrolling provider in section 2. This is for an organization that is different from the entity listed in section 2, but has ownership. Indirect owners. So if there's an organization that has ownership of an organization with direct ownership, they are an indirect owner. And the easiest way to tell is to look at your organizational chart and essentially follow the structure up. And we need to go, we need to have anybody with a direct line, whether they're a direct owner or they have a direct line to a direct owner, making them an indirect owner. That all needs to be listed here. And we're going to ask for legal name, tax ID, address, any Medicare numbers or MPIs if they have them. And we're also going to ask about the effective dates that their ownership or managing control became effective and their roles. So they can tell us they're a direct owner, they're an indirect owner, they're a managing control. They could also have more than one. That is acceptable. For each, we're also going to ask about adverse legal actions. So very similar to Section 3 for the enrolling provider and 2, we need to know if the organizations listed in Section 5 have any adverse legal actions. Same thing, they need to report them. It doesn't preclude them from enrollment. They need to provide documentation. And you need to provide this for each. So if there are multiple, I just want to call out, there are 2 pages to Section 5. Again, if you do it electronic, it's all one nice page, and you have to answer that yes, no question about adverse legal actions for each entity that's being listed. One thing that we do oftentimes see on all of our applications, they'll fill out multiple Section 5As with the information, but only one adverse legal action for all of them, and that actually will cause development. So you want to avoid that if you can. Section 6, again, very much the same, but this time we're looking for individuals with direct ownership or indirect ownership. An example of an individual with indirect ownership would be somebody who owns an organization in Section 6. So we will get the organization and the individuals. If there's a government-owned body, we'll still need them in Section 5, but they can provide a statement that they're going to be financially and legally responsible for the enrolling provider. Then they only need to report any managing control. But again, that's government-owned entities or MDPP suppliers. So if it's state-owned, county-owned, municipally owned, there's some exceptions, and that information is provided in the application. And again, we do need to have their adverse legal action information reported here. Section 7 is unique to the MDPP, and this is the section where the MDPP supplier will be reporting the coach roster. So we need all of the individuals that are going to be providing MDPP services, and this is something that if you're doing an electronic version, you can just continue to add and fill out the information for each. If you're doing the paper, you will need to complete this page multiple times. So you may need to complete and print and complete and print. So we need the date that they began providing services, and we are going to need their social. We're going to need their MPI if they have one. We are going to need certification information. And this section is used not only to report new, but if a coach leaves, if the roster changes, we need to have removals, changes, additions. That's all reported using the same section of the application, but just through a change application versus an initial enrollment. But it also needs to be reported on those initial enrollments. Section 8 is for billing agencies if the MDPP is using one. It is not required, but if they are utilizing one, we need their legal business name. We are going to need tax ID or social security number, and that's usually just if you have a provider that is a billing agency that's an individual person. We do need to have all of that information. And it does need to be a street address, but a billing agency, again, is not required for enrollment. Once you have everything completed you are going to see a request in PACOS for application signatures. We're going to talk about contact individuals next, but in PACOS, it'll ask for a signature. So you can sign electronically or you can upload a signature and the system will provide you with a certification statement. You can sign that. It can be scanned in. It does need to be a PDF or a TIFF. It cannot be a picture. So it cannot be a JPEG or a PNG. It does. So I recommend PDF. And then that's uploaded to the application along with any other documentation that you're sending. With the paper application, it is a physical section, and an authorized official needs to be, in either case, an individual who can legally bind the organization into a contract. So an owner, a board member, a director, or an officer. Now, there is something called a delegated official. It is possible for the authorized official to delegate somebody that works directly with their organization to be able to sign for changes in the future, but we do have to have an authorized official for that initial enrollment application. And if they are signing the application, they are someone that needs to be reported in Section 6. So just make sure that you confirm that they are in both sections. That is also something that we do often develop for, where someone signs that's not reported. Both applications will ask for a contact person. We need the name, the address, and the phone number. You can list multiple. This contact person is going to be used not only for contacts related to the development or to the enrollment process. If there's development needed, provider enrollment will reach out to this individual or the individuals listed here. Customer service also utilizes this if a supplier calls in and asks to talk to them about the enrollment record. These are people that are authorized by an application signed by that authorized official. They're authorizing us to be able to speak to these individuals. So please make sure that you keep this up to date. If somebody calls in that's not listed as a contact or an authorized or delegated official, we cannot communicate enrollment data with them. And that is to protect the providers as well as Medicare. So documentation is a little bit different for an MDPP, just a little bit. So as I mentioned, we would need tax ID verification from the IRS, showing the legal name and the tax ID that's going to be that's listed in Section 2. We also need that recognition status verification. So something from the CDC that confirms your recognition status that you're reporting in Section 2. Again, that recognition does have to happen before the enrollment process can begin. Some additional forms that you will need include the CMS 588 Electronic Funds Transfer Agreement. This is an electronic section in PAYCO, so if you're doing it electronically, you just fill out the section and then PAYCOs. If you're doing it via paper, you do need to download the CMS 588, and I've included that link here. We will be asking for obviously account information, routing number, account information. We're going to need bank information. We're also going to ask for account verification information in the form of either a voided check or a letter from the bank that needs to be signed by someone from the bank. It can be, a personal banker, a teller, what have you, but it does need to be signed and typically needs to be within 1 year just to ensure that it's current. So we do need that. One caveat with that for both PAYCOs and paper, we cannot accept starter checks. So if it's something that you wrote all of the information in, that's not an acceptable form. So that's why that letter is an option, just in case there aren't checks in place yet. So here I have included some CMS resources that'll help you. One really useful document that I found is an FAQ that CMS has posted specific to MDPPs. It talks about multiple things, including the fingerprinting process. That was a pre-submitted question that we did receive, and there's additional information here. I'm going to talk about that question in a little bit. I've also included a link to Chapter 10, which is the Program Integrity Manual. In Section 10.2.6, I mentioned the CFR earlier, providing all of the information specific to MDPPs. The enrollment criteria, so enrollment criteria specifically including what the MACs are being asked to look for, is outlined in the Program Integrity Manual. So if you want to take a look at that. I've also included a link to PAYGOS, in case you're interested in looking at that. And then there are some MDPP tutorials and preparation guides that I'm making available to you along with CMS's provider enrollment page. So a lot of good information out there if you'd like to look a little deeper. We also have resources available on our WPSGHA website. So we do have a link to the enrollment application and a page that talks about the Medicare Diabetes Prevention Program. So those are also there for you. So one question that we got as a pre-submitted question was asking about the fingerprinting process. So I'm just going to cover that and then I'm going to check in with Ellen. MDPPs are classified as a high risk from a screening requirement. So there are going to be times that CMS and the MAC may deem it necessary for those listed in section 6 to go through a fingerprinting process. And we received a question about what that process looks like. And essentially the application will be sent in. The fingerprinting process is not something that happens prior to the application being submitted. What happens is the application comes in, it is reviewed, and then the MAC and CMS identify the need for fingerprinting. If the need is not there, the application will continue to process. If the need is there, the MAC will send a letter to the provider requesting fingerprints and providing additional information on how to take care of that process. So it is something that, as I said, cannot be done before the enrollment process, and it is something that you will receive notification if you do. And again, it's another reason to make sure that you're reporting addresses on the application that you're going to be able to receive correspondence so that you don't miss that request. All right, with that, Ellen, I'm going to check in with you. Do we have any questions in the chat?
Leanne, we don't at this time.
All right, thank you for that. So on behalf of myself and Ellen and everybody on the WPS Provider Outreach and Education team, I'd like to thank you very much for taking time out of your day to attend today. We look forward to those survey comments. And again, please be sure that you're including topics that you'd like to see in the future. So I thank you. Have a great day. You may now disconnect.